This is going to be a very short and sweet presentation. There's not a whole lot of information for me to share with you, but I do think it's enough information to get you thinking about end of life. If you are an advocate, or not advocate, excuse me, if you are a proxy or a power of attorney for healthcare decisions, this is going to be some good information for you. It's really about starting that conversation with your loved one and trying to get a good understanding of what their wishes are for their journey towards the end of their life. And this also, I think, is a good prompting point for those of us who maybe are not experiencing a chronic illness or facing the end of life right now, to start thinking about, how do we want to participate in our end of life journey, right? What are the things that we want our loved ones to know about us? And so even if this information isn't something that you can use with your loved one right away, it might be something to prompt you to kind of think about, later on down the road for yourself and the people that are going to be caring for you inevitably, right? So it's just a good topic, I think, for all of us to consider, for all of us to think about, because death is the great equalizer, right? We are all going to experience it at some point, and the better prepared we are, the easier it's going to be for our loved ones, so that we can die knowing that they're going to, not have to have an extra burden of figuring all that out for us, right? We can already have that conversation ready to go. So my agenda for today is talking about being a healthcare proxy. What does that mean? It's going to be very brief. I'm sure most of you probably already know what it is, but I think it's good to go over it anyways. We're going to talk about thinking about what matters, right? How do we have these conversations? What are we asking? What kind of information are we trying to get from our loved one? And that's going to segue into our plan for care. And I'm going to give you some suggestions on things that you can ask your loved one, or things that you can kind of turn your observation toward, right? So if your loved one isn't really in a space where they can have this conversation with you, maybe some things that you can start thinking about, and trying to use your other skills rather than verbal communication to kind of collect that information from them. And we're going to go over how to talk about death and dying. It's not a very easy thing to talk about, and some people may have reservations to even having this conversation because it is kind of a taboo topic. And then I'm going to go over briefly, what if your loved one is cognitively impaired, and how do you get that information from them? Okay. So again, this is only about 11 slides. And so this isn't going to be very long, but there will be time for conversation afterwards if you want to stick around and have that conversation, or any questions that you may have. So that way we have that time to discuss afterwards off camera that won't be recorded. Okay. So let's go ahead and get into the information. Let me pull up my notes so I know what I'm trying to say to y'all. Move my camera out of the way. There we go. Okay. So being a healthcare proxy. So when you are a healthcare proxy, you have the ability to communicate with the healthcare staff of your loved one, right? So nurses, doctors, any other member of that care team. And you'll also be able to access medical records, right? And that's so that you can make informed decisions for the person that you are representing, okay? Of course, if you don't know what the options are, if you don't know what the treatment plans may be, you're not gonna be able to make those decisions. So as a healthcare proxy, you get access to that information. So when you discuss your loved one's preferences regarding their healthcare now, you can prepare to make those decisions about tests or procedures or treatments if they become too ill to make those choices themselves. So of course, the healthcare proxy is there in the event the loved one cannot make these decisions for themselves. They are trusting you to make those decisions for them. Of course, if your loved one is still able to make those decisions for themselves, you as a healthcare proxy do not override what they have to say, right? So just want to clarify that real quick. And it's important to understand that while your decisions might have financial implications, your role as a healthcare proxy, you're not responsible for the financial matters, right? You're only responsible for healthcare decisions. So some of you may be a power of attorney, healthcare proxy, over their healthcare and over their finances. Okay, so of course, if you hold that title, then you have those, requirements or those responsibilities as well. But in the context of this information I'm going to give you today is just about healthcare and not financial matters. Okay. A healthcare proxy can also be referred to as a healthcare agent, power of attorney for healthcare, or surrogate decision maker. So depending on where you're from, who you're talking to, those terms are all interchangeable, okay? And that legal document that authorizes you as a proxy to speak on someone else's behalf, that may be known as a healthcare proxy form, or more commonly an advanced directive. That's what I've grew up knowing, or the term I grew up using. I think it's mostly common for most people to use advanced directive, but it can also be healthcare proxy form, okay? And so the advanced directive includes both the healthcare proxy form and a living will. And that living will just outlines any specific medical treatments that your loved one would want or would not want. Okay, so a lot of people maybe don't want to do any like life support, right? They don't want to live off of a machine or what have you. And so they'll put that in their advanced directive or in their living will and say, these are things I don't want. Okay. And of course, if they don't have those things available, I'm going to give you some information on how to have those conversations so that you can have that information available. Okay. So what do you consider as a healthcare proxy, right? Somebody has asked you, or just the way life has happened, you've ended up in this role to be the proxy. And that can be kind of intimidating, right? Especially if you haven't had the opportunity to have a conversation with your loved one and you're really just kind of working off of how well you know them, right? Or guesswork, intuition, or what have you. So I just want to go over some things to consider as you consider the role or have accepted the role as the proxy. First and foremost, there's no such thing as a perfect proxy, okay? As a proxy, you just have to try your best. No one expects you to be perfect, okay? There's no I feel like there's no such thing as perfection, but especially in this role, it's really just doing the best that you can, okay? And as a proxy, you're going to base your decisions on what you know matters to that person you're representing, right? You know mom, you know dad, you know your spouse, you know your kid, right? Whoever it is, they've decided that you know them well enough or best to be able to make these decisions for them, okay? So you just, trust your instinct, trust your gut, trust the relationship you have with that person to be able to make those decisions, because obviously they put you in this position for a reason, right? They trust you, so trust yourself, okay? But in any situation, your goal is going to be to give a voice to that person that you know, about their values, about their desires, when they cannot be that voice for themselves, okay? So you're going to need to speak for that person if they're unable to speak for themselves. And that really just means putting aside your priorities and your preferences and thinking about what the person you're speaking for would want, right? And this can be really tricky, and it can be really complex to navigate, especially like say you have a loved one who has a terminal illness and they know that their time is ending and they want nature to just take its course, right? But you as their loved one want them to try anything and everything to stay, right? And so that can be a really hard crossroad to be in, where it's like, I know I want you to get these treatments to prolong your life, but you don't really want them. And so being a proxy is really about being able to set those feelings aside so that you can really be the voice for that loved one. Okay. Now, if you find that this is not a space that you want to be in or that you can be in, that you're not going to be able to make those decisions, you're not going to be able to honor their wishes, that's okay, right? Let that person know if they're still cognitively able to say, and see if they can find someone else who can, right? Because really it's about the person and what they want, not necessarily what we as the loved ones left behind want. And that can be really hard. And you're going to need to be able to ask the question, or answer the question, if your loved one could speak and make their own decision, what would they say? Okay, so it really is about the person and not you as the proxy, okay? And as a proxy, you do have certain legal responsibilities, right? You have the legal power to make medical decisions for them if they can no longer make them for themselves. And in order to do that, you're going to have full access to their medical information under HIPAA, which is that healthcare privacy law, okay? So with HIPAA, we are not allowed to share sensitive medical information, personal information with anybody unless they are a proxy or a healthcare advocate, okay? Then you would have the right to see those records, okay? You're going to be able to talk to their doctor and gather information on their conditions so that you can make informed decisions about tests, procedures, or any other treatment that that person may want or not want. Okay, so of course you have to have that information to be able to make those decisions. But again, being a proxy does not make you responsible to pay for that care. It's just the responsibility to be able to accept or decline the care. Okay. And also, it's important to know that preferences aren't always possible. Okay, so sometimes it's not possible physically, medically, or financially to follow every one of someone's healthcare preferences. Okay, and that's okay. So, for example, someone might want to spend their last days at home, right? But their condition might make that impossible. Okay, if you think about maybe if you don't know that their last day, their last moments are coming and you end up in the emergency room for some reason, there may not be time to transfer them back home, right? Or it may not be the doctor's recommendation. Okay, so sometimes the preferences aren't possible, and that's okay. Right. So just in that case, you would just make the best decision that you can based on the information you have and try to find other ways to meet their preferences based on what matters most to them. So maybe they want to die at home surrounded by friends and family, but they have to be in the hospital for whatever reason. So you can always bring friends and family there. Okay, so it doesn't have to be an all or nothing. You can be flexible as the proxy to make those decisions on the behalf of your loved one. And of course, if you can't adhere to their preferences, don't beat yourself up over it because you can only do what you can do, right? Just trying your best. Again, there's no perfect proxy, just do your best, okay? So next we're going to talk about thinking about what matters. And this is the part where we're going to start kind of just getting those wheels turning. If you can have these conversations with your loved one, here's some things that you can consider. And just really, if they've never taken the time to think about these things, you can just start it with what matters the most to you, right? And how can we create this plan based off of your values and what matters to you, okay? So some questions you can ask is, what does a good day look like for you, right? So is it time with family and friends? Is it enjoying everyday activities? What do you need to enjoy a good life through the end of your life, right? And that can get them thinking, well, I want to be with, my grandkids, or I want to be with my spouse, or I want to see my friends more, right? What does a good day look like for you? What brings you joy, okay? And you can find a lot out about a person's values by asking them, what do they enjoy, right? What is a good day like for you? Next, who or what supports you during difficult times? So maybe it's their faith, maybe it's their culture, family, friends, maybe even their pets, right? What brings them comfort? Okay, these are some great questions to ask. And then another one, try finishing this sentence. What matters to me through the end of my life is, right? And that could be maybe being able to recognize your children, right? Being independent, being able to spend time with the ones that I love. Okay, so this is just a way to get that conversation started, right? And I do want to say that these questions I'm giving you, these tips that I'm giving you, they don't all have to be blurted out in one long conversation. Okay, this can be a process to just kind of start the ball in motion, right? Now, your loved one may not have a diagnosis that has a set day or timeline for their passing, but it's coming, right? Especially if they're maybe a little bit older, and maybe they have like dementia or something like that, and they know that the wheel is winding down for them, but we don't know when. Start having these conversations now, and so that way you don't have to just dump it all on somebody at one time, right? So just think about that as we go through these questions, okay? So a plan for care. So these are some great questions, and I got this from I think it's called the Conversation Project, and they have a whole pamphlet of all kinds of tips and things that you can say to people to start these conversations, questions you can ask. And I'm going to go over these questions here, and they actually on the brochure are on a scale, a 1 to 5 scale. And that's really important for those of you who are maybe caring for someone who has like a cognitive decline and they can't really answer those questions straight out, but they may be able to give you like a 1 to 5 scale, okay? But here's some questions that you can think, or that you can think to ask your loved one as you prepare to be their proxy, okay? Because you can have all their medical information and stuff, but knowing about their wishes is really going to be about having that conversation, okay? So as a patient, I'd like to know Maybe they only want to know the basics about their condition, right? And only the basics about their treatment. They don't want to know all the details, right? But then on the other side of that, they might want to know everything there is to know, right? All the details about their conditions, all the treatment, all the details about their treatment. Okay. Some people don't want to know, and it's good for you to know if they want to know, right? So that way you can opt to share that or not share that with them based on their wishes. Ask them when there is a medical decision to be made, would they like the healthcare team to do what they think is best? Or do they want to have a say in every healthcare decision that's being made? Okay, if they are cognitively able to do that. Okay, some people may want you to take a very hands-off approach to being a proxy, and only intervene when they absolutely cannot. And some people maybe just don't want the stress of all of it, and they'd rather, outsource that to somebody else, right? So it's good to have these questions answered so that you know how much participation you are going to have in this role. Okay. Next, ask them if they have any concerns about medical treatments, right? Some people might worry that they're not going to get enough care. Some people worry that they're going to have too much care, right? Maybe they don't want you fiddling and messing with everything, right? Maybe they want you to just kind of stand by and just be there for support, but they don't want, they don't want all the fuss, right? And that's okay too. Some more questions. So ask your loved one if they're diagnosed with a serious illness that can shorten their life, what's their preference, right? Do they want to know how quickly the progress is taking effect or their doctor's best estimation for how long they have to live? Maybe they don't want to know this information. Maybe they do want to know it, right? Maybe they want to know how quickly it's progressing. Maybe they want to know how long they have to live. Maybe they don't, right? If you're seriously ill or near the end of your life, how much medical treatment would you feel was right for you, right? And that, of course, these are questions that they may have to have some time to think about, right? I know I would, right? Some people may say they want every available treatment to extend their life, even if it makes them uncomfortable, right? As long as I'm alive, I'm good. And some people feel the opposite, right? They don't want to try treatments that's going to decrease their quality of life or make them feel uncomfortable, just so that they can extend their life, right? They're like, well, I don't want to extend my life if I'm just going to be in pain the whole time, right? And that's their right, right? They don't have to extend their life if they know that quality of life isn't going to be what they want, okay? You can ask them, where would they prefer to be towards the end of their life, right? Some people would really like to be in a hospital, right? Or assisted living or a nursing facility, right? They want to be surrounded by a staff or a team of professionals that can intervene, right? Or that can give them that care that they want to prolong their lives, right? And some people would really just want to be home, right? A lot of people, I think, would rather be home, but you never know till you ask somebody, right? So it's always good not to assume. And then finally, some of these questions here. If you're not able to speak for yourself, would you want people to follow all of your wishes or do what is best in the moment, right? And so some people might say that I want the people in my space, I trust them to do exactly what I've said, even if it makes them uncomfortable, right? That's, where you start thinking about those advanced directives, right? That life-sustaining or the life-saving interventions, right? They may not want those things, and they have to trust the person as their proxy to, follow through on those wishes, even if they don't want to, right? Or maybe they want you to just do what brings you peace, even if it's different from what they've said, right? So that's a conversation you definitely need to have. It's kind of hard to just kind of guess in those scenarios. If you don't have to guess, it's good to have that conversation when you can, okay? Maybe they don't want people to know about their health, right? Maybe they don't want you to share information about it with others. Maybe they don't want the people close to them to know all the details, right? Maybe they don't want to worry their kids or their spouse or whomever, right? But then again, maybe they're more comfortable with that and they want people that are close to them to know all the details, okay? So you don't know. And that's the thing. You can make choices for their health care, but then even respecting their boundaries and giving them that dignity of like, how do you even share or what do you share with other people, maybe that are outside of the healthcare world, right? Maybe they don't want, all the extended family to know all the nitty-gritty details, right? And then again, ask them when they die, do they want to be alone? Do they want to be with other people? Do they want to be with their pets, right? Do they want to have certain things going on, like music playing, or maybe a favorite blanket or something like that, right? And these are questions that you can just, again, have this conversation started so that the person has control over how their life ends as much as they can, right? And that can bring a lot of peace to people. I mean, if you think about it, we plan our weddings, right? We plan the birth of our children. If you're a parent and you've given birth, you have a birth plan. You may have, career plans, you have education plans, you have retirement plans, right? We plan for all these big moments in our lives. But when it comes to death, which is inevitability for all of us, we don't want to plan, right? And I just feel like, for me as an individual, and this might not be true for everybody, but for me, I feel like I want to have a good death, right? I want to have some say in my transition if I can. And so I would be very happy to have this conversation with loved ones. And some people may not, and that's okay too, right? You just kind of meet them where they are. But the important thing is to have these conversations as best as you can, as soon as you can, so that there's less stress and less confusion towards the end when you're already inundated with grief, right? And it's already stressful when you've got so much on your plate already. This could just make things a little more smooth, right? Run a little bit more smoothly for you. All right, so here's a quote from the Conversation Project. It says, "It always seems too soon until it's too late," right? So there's some other things that you might want to cover if you can, okay? Some questions you might ask your loved one. Do you have any worries about your health, right? Maybe they don't. Maybe they know they have a terminal illness or have a disease or something that's going to shorten their lifespan, and they're not worried about it, right? And some people maybe cannot sleep at night because they're so worried about it, right? But you can ask them that and see how they feel, and then see how you can help them navigate that, right? Maybe ask them, is there anything that they want to address to feel more prepared, right? Like finances, property, legal documents. Maybe there's some relationships that they would like to try and smooth over or reconcile before they end their life, right? Or any healthcare situations, right? Maybe they're worried about, how much is it going to cost for me to be on life support if that's something I choose, right? Do you have any fears, concerns, or mistrust about where or how you receive healthcare, right? Who do you want or not want to be involved in that healthcare, right? I know there's some people who have, sibling sets, and each sibling has a different idea on how mom's care is going to look, right? And so if you can have those conversations and let them know, hey, whoever you want to be involved is going to be involved, and whoever you don't want involved is not going to be involved, right? And so you as a proxy specifically have the right to advocate for the desires of the loved one, okay? Think about if there's anything in the future, like if they look ahead in the future, are there any important events or dates that you hope that you're there for, right? So that could be, weddings, births, graduations, things like that, right? And again, this isn't going to be something that you can necessarily change, right? We don't know the day of any of us are going to, end our lives. But it could maybe prompt you to be able to have conversations about helping them cope with some of these losses, right? If they know they're not going to be around to see the birth of their first grandchild, there might be some grief there that they want to kind of, reconcile, right? And so this is a way for you to really connect with the person in a way outside of medical care to just really ease that concern or that maybe the heaviness that they feel in their heart that can help them kind of let go and release, right, when the time comes. Are there any kinds of treatment you want or don't want? And if your health conditions change, would it be okay with you to shift from trying to cure an illness to trying to enjoy the end of your life as much as possible, right? And so that way you kind of know how you can navigate the end of their life by knowing more of these answers to these questions. Okay. So how do we talk about death and dying? And I've only got a few more slides left, but I think this one is really important because, again, we don't like to talk about this kind of stuff, right? It's sad and it can be scary, and it's easy to kind of slip into denial as a way of self-preservation, right? So there's a number of reasons why we find talking about death and dying difficult. So fear of saying the wrong thing, right? Hurting someone's feelings, especially if you say, I want you here, but I don't want so-and-so here, right? So here's some ways that you can just start that conversation, okay? I think it's always a good idea to talk face to face about hard topics, especially about this one. But if you can't talk face to face, especially if you're like a long distance caregiver, or maybe the person you're talking to doesn't feel comfortable doing face to face, but they'd be okay with a phone call, right? That's fine too. I just think it'd be, a good practice to avoid like email or text or something very impersonal when you have these conversations, right? And try to have them in quiet, comfortable places where you're not going to be interrupted, right? Turn off your phone so you won't be disturbed, turn off the TV, what have you. So that way you can really have these intimate and vulnerable conversations without distraction. So we don't want to use euphemisms, right? We don't want to say gone to sleep or passed away, which I guess we use passed away, but we just want to use that clear, honest language, right? That's very important, especially if you're talking to someone who has like dementia or someone with like a learning disability or a child, right? We want to use that honest, clear language that's appropriate for the audience, right? We want to make sure that the people that we're talking to understand what we're saying, okay? And people can have very different reactions to death depending on their attitudes, their beliefs, and the relationship they have with the person who's passing away or who's dying. So it's important to take their individual feelings into consideration, and we want to avoid pushing anyone into talking if they don't want to. Okay. These conversations are important to have, but we don't want to bully somebody into a vulnerable space, right? The conversation will come. And so if they don't want to talk about it, that's fine, back off, and then just revisit it later, okay? But first and foremost, we definitely want to make sure that we're being honest, okay? So often in difficult situations, we try to search for, the right thing to say or the clever thing to say, right? Or we can just deny what's happening altogether. And that's natural. And humor obviously has its place in these spaces, right? To have, to kind of break up some of those nerves. But dying is a profound process, and that needs honesty and that needs understanding, right? So being frank, having open conversations, that can be very liberating, and it can actually soothe you and your loved one that you're having these conversations with, okay? Next, listen, right? Listen to the other person. Pay attention to their body language, right? Especially if your loved one maybe can't formulate the words or doesn't have the words to say what they really feel. Pay attention to their body language, right? Don't be afraid to look at them in the eye when you're talking to them, right? Listen to their tone of voice and try to be aware of any way that they maybe change the way that they speak or behave, right? So an example, if they avoid eye contact, they might not be ready to have that conversation, okay? And that's all right. Again, we can just always come back, right? And then stay calm, right? This can be incredibly emotional for you, right? This emotional intimacy might be very difficult for some of you. Or maybe you're worried about seeing your loved one sad or cry or appear helpless or vulnerable, right? That can be really hard. So just breathe, right? Calm yourself. Keep yourself grounded by physically feeling your feet on the floor, right? And that can kind of keep you in a reality space and kind of keep from reeling, right? It's going to help you to be present and just really accept what is happening, okay? And don't be afraid to cry, right? Crying is natural. It's a natural response to emotionally charged situations, okay? And being brave enough to express that grief, that can have a profound healing effect on the person you're talking to, right? And it also can give them permission to grieve, right? Maybe they feel like they want to cry. This is sad for them too, right? And you don't have to talk the whole time, right? Maybe just being beside someone in silence, that can really comfort them, right? And I think the goal here is just to get to that place where they are accepting of it, of what's, the reality of their journey here. And so are you, right? And just let them know that they can talk to you if they need to, right? So you can say, like, if there ever comes a time where you want to talk about something, please tell me, right? If this conversation is too much for you now, let me know when you're ready, right? And that gives them permission to talk on their own time without the expectation, okay? It's not an easy conversation to have, but it can be made easier by your willingness to kind of let them take the lead, okay? And this is my final slide. What if your loved one is cognitively impaired? So this slide I'm going to talk about in the framework of dementia, but this could be for any diagnoses, any age group, okay? So of course, if your loved one is able to process information effectively, like in the early stages of dementia, or maybe they're, an adult that doesn't have cognitive impairment, or if they're a child with, a good understanding, of course, you want to use the language that is good to use for children. But you can just kind of lead them through those questions we talked about earlier, right? And, even just do like a scale 1 to 5, like we talked about earlier, right? And just try to know as much as you can from them in these stages, and let them know as much as they can about their treatment and all that stuff, so that they can have that conversation with you, right? Now, if you have a loved one who is in the middle stages of dementia, right, or mid stages of their disease, or maybe have a decline, whether it's from dementia or not, just try to gather this information in small bites, right? And look for the right opportunities to talk, okay? If you are caring for someone who has dementia, they will often have moments where they remember certain events clearly, like an extended illness of a friend, right? And those topics can offer the chance to ask questions that might uncover their medical preferences, right? Well, I know my friend Sally had this, for a long time, and this was what it was like for her, and I don't want that for me, right? But just gather that information in small bites. Make sure that they are, because your loved one maybe be more alert during certain times of the day, and maybe more combative in other times of the day. So you just want to time these conversations. And again, try not to sit down and have the whole thing at once, because if they have cognitive impairment, it's, you're just gonna have to redo it, right? They're gonna forget that you had that conversation, or maybe not remember all the details, okay? And then in the later stages of dementia, or if they have a cognitive decline from another diagnosis that prevents them from participating in this conversation, it may be a good idea to hold a family meeting, right? Or the people who are involved in their care, outside of, medical professionals, obviously. But have that meeting where people can talk about, well, I think mom would do this, or I think dad would say that, right? It's not uncommon for doctors to have the whole family in the room, and everyone there is absolutely positive that they know exactly what their loved one wanted, and everybody has a different idea of what that is, okay? So it's good to have those conversations before you're in the doctor's office, right? Before you're in the hospital, so that we all are on the same page of what mom wants or dad wants or whomever it is, right? And so we need to ask the questions like, how does my loved one make decisions, right? Let's try to use those skills on how they make decisions. Let's try to do that for them, right? Did they say something about, someone else who had this disorder or this diagnosis, and how they wanted things to be different or the same, right? Just figure out what that person wanted. And again, not what you want, because it might not always be the same thing, okay? And so really, if your loved one has a cognitive decline or impairment, you really kind of have to be a detective here, right? You have to use your intuition. You have to translate signals. You have to pay attention to body language, right? And that's really going to be difficult, especially if you're kind of plodding through this underlying stream of grief, right? Doing another thing on top of that can be really difficult. But if you can separate yourself from that grief long enough to view their behaviors, or their body language and things like that, it'll make it easier for you, right? And just try to remind yourself that even if there's a lot that has been lost in your loved one, there's still a lot that remains, okay? And you can really collect a lot of information from someone, just based off of how they navigate people, how they navigate things. You can look and see if their face is scrunched up, if they're in pain, even if they're not saying that they're in pain. And so just really being aware of the other ways that we communicate that's not verbal, and try to make notes of those. And so you'd be like, well, mom's not comfortable, let's get her warm, or whatever it is, right? You kind of have to use your super sleuth and your intuition to get it done, but it can be done, okay? And again, just remember, there's no such thing as a perfect proxy, okay? So if your loved one cannot verbalize this information to you, just do your best, right? They've put you in this role for a reason. They trust you're going to do the best that you can, and they trust that your best is good enough, Okay, so you can trust that for yourself as well. So that is my complete information for you today. Um, I know it's shorter than normal, but I warned you of that in the beginning, so we're all on the same page, right? So let me stop my share and my recording.